Hello, and welcome everyone to the first DCR Podcast. My name is Tara McKinney. I'm the Public Outreach Director in the Division of Cannabis Regulation, and I am here with my co-host, Shayna.
Hi, I'm Shayna Arndt. I'm the Deputy Director for Patient and Application Services here with DCR, and I'm so excited to be here, Tara. We've made it. Happy New Year.
Happy New Year. It has been crazy this year with all the weather. We've had to postpone this recording several times. So glad to be here today so we can get this started. It's really important for DCR, Division of Cannabis Regulation, that we provide information about cannabis regulation in the industry in an array of different ways. We understand that people absorb information in many different forms,
Right, and we have a ton of information on our website. The division will also have a Cannabis Quarterly Connection newsletter, which is brand new, and we're also setting up an email subscription so that everyone can stay up to date on the latest. In addition to this podcast, we really hope that everyone taps into those resources.
Absolutely. But for those of you that do prefer listening over reading, this is for you. Woo. And listening on your commute, while you're exercising, out on your lunch break, make sure to share with a friend too.
And we'll be here monthly. We'll give you a full rundown of all the different ways to get this information again at the end of the episode.
For this first episode, we are going to give a little background and history of the Division of Cannabis Regulation, where we've been and where we are. Shayna, you've been here for a long time, or longer than me.
It feels like a long time. So I actually started here in December of 2019. I recently passed my 4-year work-iversary with the state. And that was about a year after the voting passed. And I started as a frontline team member, answering the calls in the call center, doing emails, and working with patients and developing the patient medical program as it was at the time. But I started just a year after the vote was approved. That happened on November 6th of 2018. Voters approved Amendment 2, which made medical marijuana legal in the state of Missouri. And then from November to June, a lot of work was done. And in June, the first patient, first caregiver, and first patient caregiver cultivation cards were issued, meaning that folks who had one of these medical identification cards could legally be in possession of medical marijuana. And then in December of 2019, when I came around, the first facility licenses were awarded. And then in October of 2020, the first legal sale was made in the state of Missouri.
Wow, yeah, and just going around the state talking to different licensees, they remember that date very, very well. And there's something special about them remembering October 2020.
Truly is like a core memory. And that was also during the pandemic. You know, us at the state and then all of the licensees worked extra hard during that time to make sure that we could get there. And when October came, it was life-changing.
Yeah, absolutely. So from there, in December 2021, there were 300 operating facilities. Those included dispensaries, cultivation, manufacturing, testing, transporters, and seed to sale. And in January 2023, consumers who are 21 years of age were able to apply to grow plants for personal use. Then finally, in February 2023, licensed facilities were approved for adult use sales.
Which sort of brings us to now. Our rules went into effect this past summer. We've been hiring a lot of people, and since February 2023, things have really been moving.
Yes, I've only been here since July, and just since that time, we have expanded so much. It's like every day I'm walking down the hall seeing a new face. In fact, we've gone from about 57 employees to almost 152. So it's really awesome to see the division grow like this.
Yeah, and I think a lot of the people that have come on are really dedicated and really have the vision of what this program's meant to be. So I am really excited to see our group expand in such a way. Our division's now made up of 4 sections. We have the Office of Operational Support, which does all of our internal support things. There's the Office of Business Opportunity, which is aimed at helping those that are disproportionately impacted by the prohibition of marijuana get into the industry. And then section for Patient and Application Services, where I live. We handle individual license types and facility license types as they apply for licensure. And then the section for Enforcement and Compliance does everything after licensure and keeps those businesses, dispensaries, all of the facility types going the right way.
Right, and then under each one of those sections, there are bureaus and units that also do different things. So if you'd like to check out our organizational chart and function list, You can find that on our homepage at cannabis.mo.gov under contact information. Really excited about our next segment that we're doing.
It's time.
It's time. We'll have a segment each month called The No Zone.
The No Zone.
And this will be an opportunity to define some things for maybe beginners that don't know what quite cannabis regulation is, or what cannabis is, or what this is all about.
Yeah.
So our first episode of The No Zone is what is cannabis? Here to provide that for you is Lindsay Roots.
Hi everyone, my name is Lindsay Roots, and this week we'll be talking about cannabis. What is cannabis? Cannabis is a plant, also known to some as marijuana or hemp. Each cannabis plant has hundreds of different metabolites within the plant, also known as terpenes, phytocannabinoids, or even flavonoids. But what we are all most common with, and really what determines the difference between hemp and marijuana, is THC and some of those cannabinoids. So with that, many consumers are interested in what level of cannabinoid your marijuana may have. And that is kind of one of those, again, those determining factors between marijuana and hemp. So anything with higher than 0.3% THC when it's in its dried and cured form or by dry weight is considered marijuana. Anything less than 0.3 THC is considered hemp. And so you may see a little bit of differences between the cannabis plant in those ways. Some of the other cannabinoids within the plant are CBD and CBG. Those are with THC make up the top 3 cannabinoids that can be found within a plant. With that, CBG actually is more prevalent in younger plants and turn into THC and CBD as the plant matures through its flowering phase. Many consumers may be looking at those cannabinoid profiles to help make decisions in their products.
Awesome. Thank you so much, Lindsay, for that explanation of cannabis. There's much more information to that. That was just a little synopsis. You can find more information about cannabis on our website at cannabis.mo.gov under resources.
Thank you so much, Lindsay, for taking us to the No Zone. We'll see you next month.
See you next month.
And because this is our first podcast, it would only be fitting to have our very own Division of Cannabis Regulation Director, Amy Moore, as our first featured guest.
Welcome, Amy.
Hi, ladies. Good to be here.
We know you, but tell the people a little about yourself.
Well, sure. So, as you mentioned, I'm the director of the division. I've not always been the director, though. I started here as the deputy director and counsel for the then medical program. Shortly after the law passed in late 2018 is when I arrived. I am an attorney. I've worked in government since I got my law degree. Before joining DHSS and the cannabis program, I worked for the Missouri Public Service Commission. They're the ones who regulate the big public utilities. And my role there was to be legal counsel for a while, and then legal counsel, legal advisor, and policy advisor for the chairman of the commission.
So Tara and I were talking earlier about all the changes in the division, new structure, new staff, new rules.
Yes, in fact, it'll be a year next month since adult sales began. How has that impacted the division and the work that we do, and is it different?
Quite a bit different. As you guys know, and as many do, we started as a medical program. We had about 57 people on our team. And then when adult use passed, we had new or more complex responsibilities. And so we expanded quite a bit. And just like with any organization, that's going to have an impact. So we very quickly brought on a lot of new folks to our team. We're up to, or we will be in about a month, up to about 150 total for our combined medical and adult use program. You mentioned a lot of other changes too. Change has always been constant for our program, but this has been a significant year for us. A lot of newness, a lot of new folks, new regulations, new responsibilities. It's all good. We know change. We love change. We're doing fine, right? This is fine. But yes, it's been an exciting year.
What is one thing that you want the public and licensees to know about us here at DCR?
It changes as we go along. There are always things that I hear questions or rumors, and I would love to be able to share one thing or another. But actually, the thing I've been thinking about most lately, as I'm enjoying this new team that we're building, is what an array of experiences and expertise we have. It's always been a really good mix. I think that's something that we focused on when we were bringing on our original folks, is to make sure that we had a really wide range of experience. And now it's even wider. So, we've got science folks, we've got backgrounds in marketing or law enforcement. We actually have quite a few individuals with cannabis industry experience now. We had a few in the beginning, we've got more now. It's just a really wide array. And I think that's what's made us successful in the past, and it's going to be our strength going forward.
Yeah, exactly. We talked a little bit earlier before you came on, just how exciting it is to walk around the halls. I've just been here since July, and every day it was like a new person and a new face, and getting to know them and working with them, and all the work we're doing to create our culture here at DCR. It's just really great to be part of something that's so innovative, and all the staff are excited about that too.
Yes, the level of excitement right now is pretty high. And I want to also just echo what you said about being part of something new. From the very beginning, we have, these days where we get together and we meet the new folks. We've always done that. It's more of an event now, as sometimes you got, 15 new folks all starting on the same day. But consistently throughout the life of the program, there is something that we all have, which is this excitement to be part of something new, to build something new that's never existed before, to be on the ground floor of that. I talk to a lot of people out there in the licensee community, and they feel the same. It's a commonality we have. Being part of something brand new is just always going to be exciting. And brand new for us is probably not going to change for a while. There's always going to be some new development in what we're doing, and we're all going to be on the forefront of that. So it is always going to be an exciting time to be part of this.
From the point of view, we were talking earlier that I've been here since late 2019, just about a year after the program got started. And, really speaking to how you said, we focus on getting a wide range of talents and skills and backgrounds. I think even the folks that have been here since 2019, it still feels so new because we are always pivoting and, somersaults, cartwheels, and it stays exciting and it stays new feeling.
Yes, it's not a place where you would expect to be bored anytime soon.
Thank you so much for coming on. Speaking of new, this is our first podcast ever, and so we were happy to have you as our first guest. Is there anything else you'd like to add before we let you go for the day?
Really only that I'm excited about what you guys are doing here with this podcast, and there's a lot of new communication efforts. Tara, you've been great at leading those, all this new outreach that we're doing. We want to make sure that from the very beginning, I think everybody knows we've been accessible. It's something that we hear a lot from the industry community, that's unique to Missouri. And we want to continue that, and we want to broaden it. And so things like this and our newsletter and all of the visits that you're doing to our licensees for these one-on-one conversations with their leadership, I'm just excited about that whole bundle of things where we'll get to expand our reach and expand our opportunity to hear from people and what their experience is, what they're going through. I think it'll make us better.
Agreed. Thank you so much for joining us, Amy. It's been lovely to have you.
Well, thank you. Invite me back anytime.
Will do.
Absolutely. Well, that is all for today. I want to thank you for tuning in to our first podcast. We hope that you enjoyed it.
Join us next month. We're going to talk about going to a dispensary. What do you need to know? How much can you purchase? All of those good things. We'll also talk about patient versus adult use purchases and what that could mean for you. And then we'll hear from Justin Smith for a packaging and labeling update and a business licensing update from Sarah Birch.
Yeah, Shayna, so excited for next month. Lots of great staff as guests to talk with us. Erica Ziegler with Patient and Application Services will be here, and Andrea Balkenbush, our very own Deputy Director, is our special guest. It's going to be a great episode. Mm-hmm. You can always keep up between episodes by visiting our website at cannabis.mo.gov. We have some exciting things coming out in February. The Cannabis Connection newsletter, published quarterly, and a new email subscription platform that will allow licensees and the public to register their email address to receive emails on specific topics. Be looking out for that information on those. We'll see you next time.
We'll see you next time.
This podcast content is intended for adults over the age of 21 years old and is best to be used for informational purposes only. The content does not constitute official compliance or regulatory guidance. The department and author assumes no responsibility or liability for any errors or omissions in the content of this podcast. The information contained in this podcast is provided on an as-is basis with no guarantees of completeness, accuracy, usefulness, or timeliness. Cannabis licensees should consult with their assigned compliance officer for rules and regulations specific to their facility. The content is not intended to diagnose or treat any medical condition and should not be relied on for any medical purposes. Patients and the public should consult with their healthcare providers about medical-related questions and the impact of cannabis on health. If you believe you are having a medical emergency, call emergency services. The views, thoughts, and opinions expressed herein are those of the authors, presenters, and do not necessarily represent the official views of, nor an endorsement by, the U.S. government, Missouri Department of Health and Senior Services, or the government of the state of Missouri.